Hey everyone. Today we're fact-checking a viral short that claims, quote, "The most dangerous thing for your heart is anything that decreases nitric oxide," and that mouthwash, seed oils, and refined carbs are the big culprits. Let's test that. First, what actually drives heart attacks? Across decades of research, the strongest, most consistent risk factors are high LDL cholesterol and ApoB, high blood pressure, diabetes, and insulin resistance, smoking, kidney disease, and age. Nitric oxide matters. It helps vessels dilate, but calling low nitric oxide the single most dangerous thing is an exaggeration. People do not present to the ER with nitric oxide deficiency. They present with plaque rupture on top of long-term atherosclerosis driven primarily by ApoB-containing lipoproteins, blood pressure, and metabolic disease. Next claim: foods that increase insulin resistance, refined sugars, refined starches, and seed oils decrease nitric oxide. Let's separate those. Refined sugars and refined starches, fair criticism. Chronically high glucose and insulin are linked to endothelial dysfunction and lower nitric oxide signaling. No argument there. Seed oils. The evidence does not support the blanket claim. Replacing saturated fat with polyunsaturated fat, like the linoleic acid-rich oils in many seed oils, tends to lower LDL and ApoB and reduces cardiovascular risk in randomized trials and meta-analyses. That doesn't make French fries a health food, but blaming seed oils themselves for insulin resistance or heart attacks is not supported by high-quality human data. Quantity, processing, and overall dietary pattern matter more than the source of unsaturated fat. Next claim: mouthwash is a major nitric oxide killer. Here's the nuance. Some antiseptic mouthwashes temporarily reduce nitrate-reducing bacteria in the mouth, and a couple of small studies show short-term blunting of the normal blood pressure drop after exercise or dietary nitrate. But those effects are modest and transient. There's no solid evidence that routine mouthwash use meaningfully raises heart attack risk. If you have a specific reason to use antiseptic mouthwash, like periodontal disease advised by your dentist, oral health benefits can outweigh theoretical nitric oxide concerns. If you don't need it, you don't need it, but this is not a top-tier cardiac risk factor. Now the eat this to raise nitric oxide list: arugula, beets, dark chocolate, citrus, garlic, pomegranate, fermented foods. Mostly fine, especially nitrate-rich vegetables like arugula and beets. Dietary nitrate can acutely improve endothelial function and modestly lower blood pressure for a few hours. Cocoflavanols can also help a bit, but again, these are small, short-term effects. They don't replace controlling blood pressure, lowering ApoB, moving your body, sleeping, and not smoking. So what's the real evidence-based playbook if you care about your heart and, yes, your nitric oxide pathway? 1. Keep ApoB and LDL in a healthy range. That's the particle that actually gets into artery walls. Diet quality helps. Some people will still need medication, which is okay. 2. Control blood pressure. Weight management, physical activity, low sodium, high potassium foods, and, when needed, medications reduce events. 3. Improve metabolic health. Cut ultra-processed foods and excess sugars. Prioritize fiber, protein, and minimally processed fats, and move daily. Insulin sensitivity improves nitric oxide signaling as a downstream effect. 4. Don't smoke or vape. That one short video got this part right. Smoking absolutely injures the endothelium and crushes nitric oxide. Quitting is one of the biggest risk reductions you can achieve. 5. Oral health matters, but you don't need to fear every mouthwash. Brush, floss, see your dentist. If you love antiseptic rinses and don't have a medical reason, consider using them sparingly or switching to a non-antiseptic rinse. But don't confuse that with a major heart disease lever. 6. Enjoy nitrate-rich veggies, arugula, spinach, beetroot, and flavanol sources like cocoa as part of a balanced diet. Think of them as small helpers, not magic fixes. Bottom line, nitric oxide is one piece of vascular health, not the master switch. The most dangerous things for your heart are still the classics: high ApoB, high blood pressure, diabetes, and smoking, compounded by sedentary living and ultra-processed diets. Focus on the levers that actually move long-term risk, and use the sexy nitric oxide tips as garnish, not the main course. If you found this helpful, hit like, share it with a friend who saw that short, and drop the next claim you want me to fact check. Stay curious and stay evidence-based.